The first one that comes to mind, I guess, would be a blood test to check for inflammation. That is actually not specific to IBD, but it's often referred to as an IBD panel of sorts. So being tested, your ESR rate and also your CRP level will be tested, and both of those are generalized measures of inflammation in the body. That can sometimes indicate, I mean, it can indicate anything like an infection, but it also often indicates disease activity for some of these autoimmune diseases, particularly inflammatory bowel disease. Some of the other tests that are available would be basic radiology tests, whether that's an X-ray or a CT scan, those sorts of things to take a better look at the digestive tract. Oftentimes, those will require that you drink contrast so that they can see those organs and see how things kind of pass through that area. There are a lot of different diagnostic procedures that can be done for other complications related to the Crohn's disease, but a basic test would maybe be an X-ray or a CT. And then I would also say that a colonoscopy is often used as a kind of a definitive diagnostic test. And probably I would say an endoscopy too, depending on which part of the digestive tract it's affecting and which is the most painful or those sorts of things. So to get a clear diagnosis, it usually takes a colonoscopy, and they usually have to biopsy some of the tissue. So sometimes that takes a little while. But the blood work can kind of be indicative of that as well. And so there are a few different things. And I think every specialist sort of has their own way about going about diagnosing someone or kind of seeking answers for some of the symptoms that present themselves.